is Mark Rweyemamu. I'm the Executive Director of the Southern African Center for Infectious Diseases and Surveillance. We were formed in 2008, January 2008, as right from the start as a One Health-based consortium. We operate in Southern and Eastern Africa. Our founding members are in South Africa, Mozambique, Zambia, and the Democratic Republic of Congo, and in Tanzania, where our headquarters is based and where my office is based. Right from the start, we set up SACIs as jointly owned by academic and research institutions that are involved in infectious diseases of humans and animals. And our approach or our focus on One Health is one of collaboration between the social sciences and the natural sciences in our search to understand the interaction between human and animal and environment with a view to improving public and animal health. I say public and animal health because we are focused on infectious diseases. So our mission is one of developing capacity for research in Africa, capacity for the detection of those agents, their identification, and with a view to their risk management. So we undertake programs in emerging diseases, for example, Ebola, which is of great concern to us in Africa. And within the first year of our formation in 2008, there was an incident of a patient taken sick in Lusaka, Zambia, to South Africa. We were already conjoined, and cut the long story short, this resulted very quickly, within a space of less than 2 weeks, the identification of an agent which was killed that patient, killed the attending nurse, and killed also 3 other people in our hospital. The 5th one was recovered because we were able to intervene with the antiviral. We were able to do so because within natural term, this virus had been identified as completely new arenavirus causing hemorrhagic disease. And in the end, we called it Lujo, signifying Lusaka and Johannesburg. We also work on other diseases which are emerging in their presentation, like Rift Valley fever, whereby, for example, in Tanzania, we've got this peculiar issue of a rift on the eastern flank and the western flank. On the eastern flank, we've had periods of Rift Valley fever outbreaks since 1930. In 1930, there were 2 outbreaks. And then every cycle, the numbers have been increasing. The latest, which was 2007, 175. And then, but that is on the east. On the western side, we find no outbreaks, and yet we begin to get evidence that is viral activity. So those are some of the elements we're looking at why, what could be happening. And we operate, and part of going to answer why is our formation involves involvement with smart partnership with those who are at the discovery end of research. So we can pose those kind of questions. How do we work together towards that goal? We firmly believe that both global health and One Health does involve that we work together not only across institutions, across countries, but also in a global function, because these are global issues.